Thank you for joining us. I sat down earlier and spoke with Dr. Robert Thompson and Dr. Jeffrey Martinez, two of the doctors from Veintec, and 4 different patients as well, to find out about Veintec from them directly. We hope you'll enjoy the information provided in these interviews. Good morning.
Good morning.
Can you tell us about Veintec?
Veintec is a group of 4 board-certified vascular surgeons who deal only with vein disease.
And how long has Veintec been in business?
Approximately 25 years.
Wow, that's a long time. So why Veintec?
Well, Veintec has physicians that are all board certified in vascular surgery, and all we do every day there is take care of varicose veins and spider veins.
So the only thing that Veintec does is veins?
Only veins.
It sounds like you guys are really the place to go.
But we have the highest volume and probably the most experience of anyone in the city.
And what's the difference between varicose veins and spider veins?
A spider vein is just a skin surface vein that you can see just like a line on the skin. Varicose veins you have to think of as abnormal enlargement of veins that normally transport the blood back to the heart. So multiple pregnancies, prolonged standing, some heredity, all will make those veins become larger and more visible.
Do spider veins turn into varicose veins?
Totally different. Spider veins are more of a cosmetic issue. Varicose veins can cause the bleeding, the blood clots, and ulcerations.
And do both men and women get varicose veins and spider veins?
We certainly see more women with varicose veins, but men get them too, and they can be just as problematic for them as they are for the women.
Statistically, about 15% of men and 40% of women.
So you see a lot of women in your practice?
And probably that's more because of childbirth.
And what type of procedures do you do at Veintec?
We do all procedures for spider veins and varicose veins.
And what are the procedures actually like?
Well, for spider veins, in general, we perform what's called sclerotherapy, where we inject a solution directly into the vein to clear those veins up. For larger veins, we may do something called an endothermal ablation with either laser or radio frequency to seal the veins from the inside out. And in some of the veins, we'll actually perform what's called a mini phlebectomy, where we physically remove the veins.
So if I decide that I want to have my varicose veins done, I call and make an appointment, what can I expect at that first appointment?
Your first visit, you'll be welcomed by our bilingual staff, and you'll be seen by the doctor as a consultation to decide which type of veins need treatment and which ones are just cosmetic treatment. And depending on the size of the vein and the sonogram that we do at that visit will determine what kind of treatments you need. They'll all be explained to you, and if some of them are covered by either Medicare or insurance, we will meet the criteria to cover those procedures as well.
So it could actually be covered by my insurance?
Most larger veins are covered by insurance and Medicare. The smaller spider veins are usually cosmetic.
That's great. So when I come in that first time, I will actually see a doctor?
You'll see one of our physicians, and you'll also probably undergo a sonogram if there's some large symptomatic veins. And then you'll be seen by one of our nurses who will explain some of the other cosmetic procedures to you.
What exactly was going on with your veins that was a problem for you?
I'd had deep vein thrombosis with a blood clot in my leg, and then I had severe varicose veins.
It's basically the removal of a really large varicose vein on my inner thigh that caused me a lot of pain.
What exactly did you have done?
Remove the varicose vein.
So you had a large varicose vein?
Yes, quite a few in the front.
Well, I know this is everyone's first question. Is it painful?
I've never had it done, so I can't say that, but most patients tolerate very well with just some anti-inflammatory agents afterwards.
The procedure itself was completely painless.
Be honest, was it very painful?
No, ma'am.
Really?
No.
Huh.
Well, we do all of the procedures under a local anesthetic in the office. So once the local anesthetic is in, the patient doesn't feel anything.
It really wasn't what I'd call painful, and I was able to go back to work right away, felt better walking.
And how long does it really take to recover from the process?
Most people will put their stocking on and walk out that same day, and some people even go back to work that afternoon.
Wow.
Most everyone will definitely go back by the next day.
So the recovery time was almost nothing at all?
Took one day off to have the procedure done. I was back to work the next day.
Really?
Up and down ladders, up and down stairs, carrying on my regular duties.
The procedure itself only took maybe about 20 minutes. I was wrapped with an ACE bandage and sent home, drove myself home, took some Motrin, and that was all there was to it.
What about the vein now? What's it like now?
You see anything?
No, it looks fantastic.
See? He did a marvelous job. I'm very pleased with it.
The results were immediate. The vein was gone. It was so large, you know, it was very, very visible from several feet away. I could definitely see that that big, ugly thing wasn't staring at me anymore.
My legs really feel good.
Really?
Like I say, I'm on them 7-8 hours a day walking, but I'm extremely happy that I got it done. I think it's added more time to my career.
So overall, what would you say your experience with Veintec was?
If I had it to do over again, I would certainly do the same thing again. I was really pleased with the outcome.
So you would recommend Veintec to your friends?
I have recommended Veintec to all of my friends.
I would recommend Veintec and Dr. Martinez to all my friends, my family.
I recommend it to anybody because you can find a person and the staff do it Dr. Thompson has. The staff, everybody was just absolutely great and then showed a lot of concern. When he said it's going to be okay, I trust him.
He knows what he's doing. He tells you what he's going to do, and then he does what he says he's going to do when he's going to do it. And that's a valuable commodity in this day and time.
Great. Well, thank you so much. Thank you for taking the time to find out more about Veintec. If you'd like to schedule an appointment or get more information, please contact Veintec at 1-866-VEINTEC or visit them on the web at veintec.com. We look forward to hearing from you.